Okay, let's go ahead and get started. So welcome everyone. Thank you for joining us today. So in a minute, the report authors will give a presentation highlighting the main points of the report. And the presentation will be about 20 minutes long. And after that, we will take questions. Please just use the raise hand function and I'll call on you to ask your question. And so I am recording the conference and we'll send out the recording. We'll send out the slideshow and we'll also send out a link to the report after we wrap up. And so with that, I will mute myself, turn off my video and turn it over to my colleague, Megan Sway.
Thanks so much, Kainat. Hello, everyone. Thank you so much for being here with us today. My name is Megan Sway, and I am the Policy Director for the ACLU of Maine and one of the authors of this report. Here today with me are fellow authors, James Mile, Economic Policy Analyst for the Maine Center for Economic Policy, and Winifred Tate, Associate Professor of Anthropology at Colby College. Just to give you an outline of how this is going to go, I'm going to start us out with a quick grounding of what we did for this report and what the laws are in Maine around drug possession right now. Then I will turn it over to James to discuss the economic consequences of criminalizing drug use. Winifred will discuss the personal and social costs, and then I'll wrap up talking about a new path forward. After that, as Kainat said, we will open it up to questions. So let's get started. To write this report, we talked with over 150 people whose lives have been touched by the criminalization of drugs. This included people who have been criminalized themselves for their substance use, their family members, prosecutors, defense attorneys, treatment providers, law enforcement, and harm reduction practitioners. We submitted FOA requests to a number of government entities, including district attorneys, the Maine Attorney General, the Maine Department of Corrections, the judicial branch, among other places. We also reviewed a wide array of academic literature about drug policy. We reviewed policy reports, reviewed testimony submitted to the Maine legislature over the last few years on different drug policy bills, and read news articles in Maine and nationally and even internationally about drug policy. All of this research together led to the conclusion that criminalizing drug use and people who use drugs is wasteful and ruinous in terms of the financial, personal, and social costs. The central conclusion of our report is that we must decriminalize drug use and possession. So with that being the central conclusion, I want to just take a brief moment to go over Maine's drug laws as they relate to possession. The laws in Maine harshly punish people for possession of small amounts of drugs. Possession of more than 200 milligrams of most street drugs is a felony. 200 milligrams, as you can see in the slide, is the equivalent of a raindrop. So one raindrop is enough to send a person away for up to 5 years in prison and be given a $5,000 fine. You can also be arrested for more serious crimes of drug furnishing, which is sharing drugs, or drug trafficking, which is selling drugs, just based on the amount of drugs you have on you at the time police find you. The laws on this changed in October 2021 and were even more harsh than they are now. Today, possession of 2 grams or more of most substances, which is half of a sugar packet, gives rise to a permissible inference of drug furnishing, which again is sharing drugs. This is a Class C crime, punishable by up to 5 years in prison and a $5,000 fine. Possession of 4 grams or more of most drugs creates a permissible inference of drug trafficking, punishable by up to 10 years in prison and a $10,000 fine. And that's about the weight of 4 paper clips. A permissible inference, just because most people who are not lawyers, and even people who are lawyers, don't know what a permissible inference is, it's a statutory evidentiary tool that allows a decision maker, a judge or a jury, to infer an element of a crime if there's proof of another fact that is commonly associated with that element. So for drug trafficking, for example, if the prosecution can prove that a defendant intentionally or knowingly possessed 4 grams of certain drugs, The judge or jury can infer that the defendant was guilty of trafficking or furnishing drugs because the legislature has said that 4 grams is an amount that you would associate with drug trafficking. But what this means is that people are arrested for and can be convicted of very serious crimes for possessing small amounts of drugs. Many people we spoke with used much more than 4 grams in one day. Moving on to the numbers. In 2019, 1 in 11 people in Maine were arrested on drug charges. Of the 3,614 people who were arrested for drug charges, 3/4 of those, or almost 3/4, were for drug possession alone. Those 3,600 arrests became over 6,000 charges filed by prosecutors. But of those 6,000 charges, only half of 1% of the cases filed in 2019, only 16 cases went to trial. The rest were dismissed or pleaded out. This is because, like the rest of our criminal legal system, plea deals are really how things are resolved in our court systems these days. But as we discuss in the report, plea deals can cut corner on people's rights, and they really incentivize people to plead guilty over going to trial. It's also notable to talk about who is being arrested, charged, and convicted. Enforcement of drug laws is where we see the most rampant racial disparities in our legal system. Black people use drugs at comparable rates to white people in Maine, but are 3.5 times more likely to be charged with drug possession. These disparities are worse when we look at drug trafficking charges, even when we exclude out-of-state residents. The disparities are notable at every stage, and the harms of those disparities compound, so that we start with a disproportionate number of arrests, and then from there, a disproportionate number of Black people are charged and prosecuted, and then they face longer prison sentences, and the harms just compound the farther people are pulled into the system. So to summarize, we have people being arrested and prosecuted for small amounts of drugs, a teardrop, a half a sugar packet, and are being eligible for long sentences. And the people disproportionately subject to these laws are Black people and other people of color. From there, I'm going to turn it over to James.
Thank you, Megan. As you mentioned, my name is James Mile. I'm an economic policy analyst at the Maine Center for Economic Policy. And I'm going to talk about the economic side of this report. In addition to the very real toll that the war on drugs inflicts on Maine's physical and mental well-being, we all collectively pay millions of dollars every year in financial costs. Year over year, Maine has prioritized incarcerating and criminalizing people who use drugs over making treatment for drug use more available. And not only is this approach ineffective, it's extremely costly. Right now, lawmakers are looking to draft the state's supplemental budget, and it's a good time to reflect on the way the budget represents our priorities as a state. In recent years, this priority has clearly been on criminalization over treatment. For example, in the 5-year period between 2014 and 2019, inflation-adjusted spending on substance use treatment through MaineCare increased just 2%, while state and local spending on corrections and law enforcement agencies increased 13 to 14%, 7 times as much. And over the same period of time, we've continued to lock away more Mainers for using drugs and seen the number of drug overdose deaths continue to rise almost every year. Meanwhile, access to treatment remains scarce, especially in some parts of the state and for certain types of care. There's no one-size-fits-all mode of treatment for drug use, and we need to be expanding access everywhere, but that's clearly not happening under our current way of allocating resources. Put simply, the current approach isn't working, and our priorities have to change. To give you a sense of how expensive and wasteful it is to criminalize drug use, we dug into the costs involved in the system right now. In 2019 alone, the state of Maine spent $111 million on criminalizing people who use drugs. That includes $30.5 million on arrests, $34 million on pre-trial incarceration, $4.6 million on prosecutions, and $38.6 million on incarcerating people for drug convictions. Those are some large numbers, so it's helpful to think of some comparisons. Just one arrest for drug charges costs over $8,000. That's the equivalent of 7 months' rent in Cumberland County, 2/3 the cost of educating a public school student, or 4 months of intensive outpatient treatment through MaineCare. When we look at other costs of criminalization, the inefficiency is even clearer. To incarcerate someone for 1 month in jail, and that's a length of time that's not uncommon for someone to be held awaiting a trial, that month in jail costs more than $4,200 in 2019. That's many times more expensive than the typical cost of rent or medical treatment, both of which would be much more effective in helping people than incarcerating them. Incarceration in the state prison is phenomenally expensive. Keeping someone for a year in the state prison costs more than $54,000 every year. For less than half that cost, you could provide housing, weekly counseling, and medical treatment to an individual for a year. Not only would this save a significant amount of money, but we put people on a much healthier path. Law enforcement and incarceration are not only extremely expensive approaches to drug use, but they are fundamentally unhelpful. They do not address the underlying causes of substance use and in fact create more trauma and harm. In this report, we point to better ways to invest this money, which center treatment and recovery, public health, and supports like housing and community connection. These are the programs that lawmakers should be supporting in the budget, not the same failed and harmful law enforcement approach we've been trying for decades. Now I'll turn it over to Winifred, who will speak more to the human toll of criminalizing drugs and the need for change.
Thank you so much, James. My name is Winifred Tate. I'm an associate professor of anthropology at Colby College and director of the Maine Drug Policy Lab at Colby. So there's a clear consensus for a public health approach to address the needs of people with substance use disorder. And supporting a public health approach requires the decriminalization of the possession and use of drugs and investment in our community. So I want to emphasize that people use drugs for a range of reasons, including stress relief, recreation, and to help tolerate adverse working conditions. The vast majority of people who use drugs do not experience problematic substance use, but people with physical dependence or substance use disorder consume drugs to maintain their baseline physical well-being. Now, the research for this report focused on people who have been involved with the criminal legal system because of their substance use. In the vast majority of these cases, people reported using substances to manage untreated mental health issues related to poverty, lack of access to comprehensive medical care, and experiences of trauma. And I want to emphasize that the report is based in numbers, but also in the stories of the people that we had the opportunity to interview. I won't have time to share those stories here, but I want to highlight that people told us about how substance use helped them cope with grief and loss, cope with childhood abuse and neglect, abusive partners, as well as their long struggles to find treatment that was interrupted by arrest and incarceration and stymied by lack of funds. And you can find those full stories in the report. So we often hear about reducing stigma by changing language, and these steps are important, but to truly reduce stigma requires changing laws, not just individual attitudes. Our laws determine and reflect society's values, meaning that when something's criminalized, it cannot be destigmatized. And I also want to emphasize that arrest and incarceration have become very commonplace, but these are radical, extreme measures. They not only take away people's freedoms and opportunities, but also the ability to maintain housing and employment and their community and family connections, and has done a significant financial cost, as James described, but also personal and social costs to the individual, their families, and our communities. Putting people who use drugs into the criminal legal system does not help them. This report shows why continuing to criminalize people who use drugs does not just waste money, it creates more trauma and harm. Criminalization and incarceration accelerate overdose death. People with substance use disorder released from incarceration are often not provided with adequate connection to services. And people who use drugs find their tolerance has decreased while incarcerated, meaning that people recently released from incarceration have much higher rates of overdose death. Criminalization increases the dangers of drug use because people using drugs do not know what they're consuming or the potency of what they're taking, making them especially vulnerable to overdose. And criminalization means that people are afraid to call for medical assistance in the case of an overdose because of fear of arrest and incarceration. Poor and low-income people are disproportionately harmed by criminalization, bearing the brunt of all criminal laws, including drug laws. Wealth protects people from criminal prosecution because wealthy people are able to hide their use in private. People with health insurance and enough money can pay for treatment. They can pay for cash bail to avoid pretrial detention, pay for lawyers to defend them, and pay for fines that are assessed by the court or offered as an alternative to harsh sentences. Legal defense is tremendously costly and can drive a family to financial ruin, on top of the need for payment for treatment for substance use disorder. Once someone is incarcerated, they face even more costs, and these accumulating costs can lead to hardship for incarcerated people's families and significant debt. The outcomes for low-income people are worse because they lack money, not because the facts of their case make them more deserving of punishment and makes them much more likely they would get trapped in the revolving door of criminalization. And we interviewed many people who were simply caught up in pretrial detention because they couldn't pay bail, including people who were unhoused, living in tents, and treated, in their words, like they were the drug lord El Chapo by law enforcement, making arrests for drug possession that then became charges of trafficking because of the weights that they held and consumed on a daily basis. People of color, particularly Black and Indigenous people in Maine, are disproportionately harmed by criminalization. As Megan mentioned, drug enforcement disproportionately targets Black, brown, and other racialized communities, and this effect is cumulative as people move through the system. Our criminal drug laws also mean that law enforcement are tasked with making decisions about healthcare that they are not trained to do. Police, prosecutor, judges, and probation officers often make judgments about medical treatment of criminal defendants, including overriding the clinical decisions of healthcare providers without training and without access to medical records. And healthcare providers who are delivering treatment must undergo significant special training, none of which law enforcement are required to do. Healthcare providers we interviewed told us, for people with substance use disorder who are fortunate enough to be able to access treatment in the community, arrest and incarceration interrupts and in many cases ends their treatment, leading to worse outcomes, more chaotic use, and more overdose death. The vast majority of people with substance use disorder cannot find recovery while incarcerated. The key tenets of recovery include building connections in community, identifying and understanding triggers to use, and building skills to navigate challenges. The therapy, intensive outpatient groups, and other core elements of treatment for substance use disorder that help people find recovery are not available in jails and prisons, and the condition of isolation, deprivation, and surveillance make finding recovery difficult, if not impossible, while incarcerated. And we also heard many stories of people whose substance use escalated after incarceration, as well as family members who lost loved ones to overdose death following their release. Now we're going to return to Megan for alternatives to this broken system.
Thanks, Winifred. So as I've said, our central thesis is that we must decriminalize drug use and possession, and a new path forward is possible and exists already. We can look at Portugal and Oregon for places that have moved away from criminalization towards a health-based approach. Portugal decriminalized drug possession in 2001. Under current law, anyone who is found using drugs is brought before what is called a discussion commission. That commission includes a lawyer or a judge, a healthcare worker, and a social worker. Together, they assess the person who's using drugs' level of risk and make recommendations on next steps. But very crucially, criminalization is never one of those next steps. Instead, they can recommend things like counseling, referrals to drug programs, or community service, among other things. And from the money that Portugal saved from criminalizing people, they were able to reinvest that money back into healthcare and other supports. So the country ended up investing in visiting nurses and social worker programs, and they increased access to harm reduction services and safer use supplies. Just 7 years after decriminalizing drug possession, Portugal saw that 75% of the people who used opioids opted into treatment. Oregon is another example. In 2020, Oregon voters overwhelmingly supported the decriminalization of possession of small amounts of drugs. Along with this decriminalization, the referendum in Oregon provided unprecedented money, $302 million for treatment and recovery supports. Here in Maine, as most of you know, in 2021, the Maine legislature came closer than any other legislature in the country to decriminalizing small amounts of drugs when the House of Representatives voted to pass LD 967. Although it failed in the Senate, we know from polling that a majority of people in Maine support removing criminal penalties for those who use drugs. This is a move that Maine is ready for, and as our report shows, it is a necessary move to end the harm that criminalization causes. Thank you all so much for joining us, and we'll now open it up for questions.
If you have questions, please raise your hand. I see Evan pop, your hand is raised. So Evan from the Beacon.
Hi, can you all hear me?
Yes.
Great. So you mentioned in the report that Maine has this historic surplus right now, and that you'd like to see at least some of that invested in addressing the overdose crisis. I'm wondering, kind of, are there specific initiatives or bills that you all are looking at that would be good to fund or include in the budget that you think would help when it comes to the overdose crisis?
I can start there. There are a number, so this report was written before we really saw fully where the legislature was headed on the budget. And so we don't include specific things, but I do, one of the central findings after our conclusion that we should decriminalize drug use and possession is that we need to invest in housing and community supports. And I think there are several bills about housing. I don't have specific bills for you that they should, but that this is the time to do that investment, and that investing in housing will not only help with housing costs and other things, but it will help people who use drugs find recovery. I don't know, James, if you have any ideas.
I mean, I'll just say I don't have specific bills to hand, but I do think, in addition to sort of housing and other recovery support, I think we've seen a pretty clear need for more investment in just like treatment services as well, and beds in sort of recovery centers and other places. So there's certainly plenty of places where money could be redirected, even if I'm not sure about, I have to say, I'm not sure about the bills to hand. I can try and send you, try and pull some of those or ask around for you as well.
Sure, that sounds great. And I have one more question, but I can hold off if others have questions.
You can go ahead, Evan.
Okay. I'm just wondering, it seems like you talk to a lot of people who are in recovery or people who have substance use disorder for this report. I'm just wondering if you can talk a little bit about the importance of getting those people's perspectives for a report like this. It seems like oftentimes when we make policy around drug use, it's coming from maybe the more prosecutorial or court kind of focused people. So I'm just wondering if you can talk a little bit about kind of what you learned by talking to so many folks who are involved in this issue.
I can take that since I'm the person who talked to people, and think of that as a really important and critical step for any kind of policy analysis and recommendations. First, I wanted to speak to your earlier question, which is that when we talk to people about what recommendations they make, it's all about community investment. It's about housing, it's about treatment. We have a critical need for detox centers and other, but housing. And I think this speaks to the way that substance use disorder and the overdose crisis in Maine is a crisis of social supports. It's a crisis that because people do not have the basic ability to maintain stable housing and meet their basic needs, right? In terms of the importance of listening to people, to be clear, we did talk to law enforcement, we did talk to prosecutors, we did talk to a range of healthcare providers, as well as people with substance use disorder, and the majority of whom had experienced incarceration. And I think What is so important about this moment is that everybody wants to help and that everybody thinks this is a public health crisis. And I think by highlighting the voices of people who are experienced the system, we can understand how prosecutors and law enforcement want to help, but how the system is causing continuing harm. And the experience of people who are moved into that system is experience of interruption of treatment, of the isolation and devastation of incarceration. And once we highlight those voices, we can really see that this is something, and we pair that with the recognition that this is a public health crisis, then we can see it's really a moment when we can move this into the public health system. But the first step in that is going to require the decriminalization of drug use and possession.
Great, thank you.
I see Susan Sharon next. Susan, go ahead, and I think you can unmute yourself.
Yes. Could you talk a little bit more about the racial disparities that you found in this report as they relate to Maine, both the arrest rate and then also you mentioned the length of sentence?
Sure. So a lot of the data that we found was in part based on the Council on State Governments report. So this is not, none of this should be news to anyone in Maine, I guess is where I'm going with that. Black people make up 1.6% about of Maine's population, but are 21% of the people charged with drug trafficking. And what the CSG report showed was that even when you exclude people from out of state, because a lot of what we hear is that it's not Black Mainers who are being arrested, it's people from out of state. Even when you exclude people from out of state, Black people are still disproportionately targeted. James, I don't know if you had other statistics that you wanted to talk about. That one is just always present on the top of my mind. I think we see in racial disparities, the harsher the crime or the harsher the sentence, the more likely people of color are to be charged with it. Although there was a statistic, James, about Indigenous folks are what, 3 times, I'm gonna butcher that statistic, but for Class E drug possession, which is the very lowest level, like minuscule amounts, people from tribal nations are way overrepresented. But James, I don't know if you have that number.
Yeah, I mean, so I think overall Indigenous folks in Maine are twice as likely as white folks to be arrested for drug possession, and it does increase at yes, 3 times likely when you're looking at the lowest level of drug possession. So that is a disparity that often isn't mentioned. I think partly because of the national focus on the disparity for Black folks and drug arrest. I think some of the discrimination and inequities against Indigenous folks that are also overlooked sometimes. I mean, one of the things that we also try and bring out in the report is that it's important to remember is that when you look at the statistics that we have for drug use, there's very little variation by race on just general drug use. And for example, Black folks and white folks in Maine use drugs at almost the same rate, but Black folks end up being 3.5 times as likely to be arrested for drug possession as white folks. And the fact that the disparity increases as you go up the scale shows that there's the consequences get even more severe because then folks end up being charged with harsher sentences and sentenced to longer punishments. And we're also careful to try and show that, to look at, sometimes you hear people saying, well, maybe this is accounted for by people who are coming from out of state. But even when you control for and look at the residence of the person who's been arrested or charged, those disparities continue and persist. So we know that, you know, these are things that can't just be waved away or explained by other things. They're clearly disparities that are driven by the system and as a whole.
Thank you.
Any additional questions from reporters? Seeing no hands up, I think we can close this press conference. Thank you everyone for coming. And as I said at the beginning, we'll send out a recording of this press conference. We'll send out the slides and we'll send out a link to the report so you can review it. So thank you so much for your interest and thank you for coming.